Around 75% of Americans will experience a skin condition that might need medical attention, but many people will wait weeks or months to see a dermatologist, or worse yet, get a misdiagnosis along the way. Now, a new study just came out that shows AI might do a better job than a human doctor at figuring out what that rash actually is. Hi, I'm Ryan Flynn. I publish the AI RX newsletter on how AI is changing healthcare, and here's a story from my recent edition. So the journal Nature just published findings from Google showing that their new medical AI outperformed primary care physicians in diagnosing skin conditions from smartphone photos. The system is called Articulate Medical Intelligence Explorer, or AMI, and it could identify rashes accurately even when image quality wasn't great. The study used about 25 actors playing patients in 108 different medical scenarios. Each patient had like a virtual visit with both the AI system and a human doctor. And it showed them relevant medical images, including smartphone photos of the skin conditions. When specialists reviewed the diagnoses after, the AI was actually more accurate than the physicians. And what's interesting is that the AI maintained accuracy even with poor quality photos, something human doctors struggle with. Now, the system just isn't looking at images in its isolation. It integrates patient information with the visual data, similar to how a clinician would think through the problem when examining you in person. That said, the test was a controlled environment, and the real-world care is more complex. So doctors, typically bring experience, intuition, and hands-on examination skills that can't be replicated in simulated interactions or with an AI or robot. Also worth noting, Google hasn't shared the system's code or prompts, so other researchers can't verify or build upon this work. That's a significant limitation. But this is part of a broader shift, though, happening in healthcare as AI tools become more sophisticated. More AI-powered programs are arriving that can perform at or better than medical professionals across a range of tasks. These can potentially be very helpful for people who live in areas where it's hard to get an appointment to see a specialist. But meaningful real-world deployment will face hurdles from integrating with medical systems to physician adoption and regulatory clearance. Thanks for watching, and subscribe to my newsletter for more news like this.